Now, experts have warned the public to be responsible citizens and desist from being super spreaders of Mpox. This comes after Zimbabwe confirmed the first 2 cases of Mpox in the country as the viral infection continues to spread across Africa. Experts insist those who travel from affected countries must be responsible enough to self-isolate, adding that authorities can only do so much. Travelers from DRC and other countries with more infections are facing challenges moving into certain parts of the world, and the hope is for Zimbabweans to contain the infection. To understand more, we are joined by Harare Public Health Institute Principal Dr. Amon Marume. Good evening, Doc. Now, what is the role of communities in containing Mpox, given that it's mainly spread through contact?
For instance, if I know I have traveled to or to an area where it's endemic, or I have come in contact with someone who is infected with Mpox, for example, in this case, and I come back into the country and I ignore symptoms, I don't report to the nearest healthcare facility, and I don't control, contact with a lot of people. I'm just exposing, fellow Zimbabweans. So it is also encouraged that as members of the public, we should be responsible. I am my brother's keeper. That mentality would help us. It would greatly help in terms of combating many, not just Mpox, many public health threats. Also, there is no need to panic regarding Mpox. Usually, it should resolve in under a month. Sometimes most people would not even want supportive care.
So now, how important is scaling up of surveillance at the country's points of entry? And how also do you rate the awareness in our communities?
Yeah, surveillance for public health threats is always good to be an ongoing process. So it's encouraged, especially when you have several threats to. But again, like I said earlier, I've seen that in the communication given by the government, I think the surveillance has been upped, and I think healthcare professionals have also been trained to deal with Mpox and related outbreaks. So I guess more would be to encourage, both the healthcare professionals and journalists to increase the level of awareness by communicating fully and correctly regarding Mpox.
Now, at what point do you think the country should introduce a vaccine as a preventative measure?
This because, like I said, it's self-resolving in most people. Sometimes resources for a resource-limited setting like ours are better served in improving our basic public health activities, like, for example, communicating health information, improving sanitation. So those would help us better than well, it's my only basic assessment, than to look into a vaccine for a disease of that level.
Konapo, ipapo, ba ZTN Prime, DSTV channel 294, the place to be.